Hi, it's Physio Mark here again. Welcome to week 2 of the program. Hopefully at this stage you're feeling much better because you've started using the tape to relieve your symptoms. You're stretching your calves in correct alignment, and this is taking pressure off your plantar fasciitis. And you've fitted your orthotics in and you're using those regularly, changing them from shoe to shoe. And this also is preventing your foot from rolling in too far and putting pressure on your plantar fascia. As time goes on, you'll find you'll need to use the tape less and less, because the orthotics take over the role of the tape. You might just find you need to use it on days when you're on your feet a lot. By the time you get to week 3, you may not even need to use the tape at all because the orthotics have fully taken over. Today, I'll give you another technique for relieving your symptoms using the foot roller included in your kit. I'll also show you an exercise which will stretch out your toe in a way that supports your recovery. Bear in mind, these exercises build on each other. So please keep doing the calf stretches as you go and continue to initial each square on your exercise chart as you do your exercises each day. Now I'm going to show you an exercise which is shown to be important, probably because it helps the plantar fascia to take load when we're walking. We do it with the foot off the ground in what we call a non-weight bearing position, and it involves pulling the foot back so the calf's just on a slight stretch, grabbing the toes and pulling the toes back. And if you look carefully, as I do that, you'll see some tissue coming under tension underneath the foot. I'll let that go again, that tension disappears. I'm going to put my thumb on it now so that I can feel it coming under tension when I pull the toes back. Once we get that under tension and we can feel it with our thumb or fingers on this part of the foot, now this has been shown to be most effective if we do it first thing in the morning. So we want to do 3 holds of 30 seconds of the toe stretch prior to our foot hitting the floor in the morning. So you could sit up, cross your leg over the other one, do the toe stretch, 30 seconds, 3 times before you start to walk. That will help your first step pain in the morning. It would also be helpful if it was done later in the day. So for instance, if we're sitting for a period of time later in the day, we could, before we get up again, we could cross our foot over and do the toe stretch, 3 holds of 30 seconds. And it would probably be best done a third time, maybe in the evening if we've been sitting for a while, or before bed. So round about 3 holds of 30 seconds of the toe stretch 3 times a day. This is the roller supplied in your kit for rolling the underside of your foot. We supply it to you uninflated, and it can work exactly like that. But if it's not hard enough for you and you feel as though you need more pressure, you can insert a needle valve into it like so, pump it up, and it will become much harder, and you can get more pressure on the underside of your foot if you wish. It's a good idea to use the roller once a day for a couple of minutes. It'll increase the circulation to the muscles around your foot, loosen them up a bit, and it may well provide you with some pain relief. Rollering of the calf can be very helpful in reducing tension in the calf. You can roller it like this, where you're rolling the back of the calf. You can turn the foot in to roller the inside of the calf. You could turn your foot out to roller the outside of the calf. Quite likely you'll find some sore knots in your calf. If you find that bit, you can just focus on that part and roller out that knot. As you roll your calf, you'll reduce the tension in the calf. It'll make it easier to stretch. As the calf stretches out more easily, it lowers the pressure on the plantar fascia when you're walking. When you're rolling the foot, just take a little bit of care. It can be quite helpful for the circulation to roll your foot. Don't roll it too aggressively. You need to remember there's some tender tissue over there. If you really push hard or push too long, you might, while you're trying to help the problem, actually make it worse. So just take care when you're rolling the foot.